This is Dr. Ben Weitz with the Rational Wellness Podcast, bringing you the cutting-edge information on health and nutrition from the latest scientific research and by interviewing the top experts in the field. Please subscribe to the Rational Wellness Podcast on iTunes and YouTube, and sign up for my free ebook on my website by going to drweitz.com. Let's get started on your road to better health. Hello, Rational Wellness Podcasters. Thank you so much for joining me again today. And for those of you who enjoy listening to the Rational Wellness Podcast, please go to iTunes and give us a ratings and review. That way more people can find out about the Rational Wellness Podcast. For those of you who'd like a video version, go to the YouTube page, Weitz Chiro, or search for Rational Wellness Podcast, and please subscribe there. And also, I provide a full transcript of every podcast, and it should be connected with the iTunes link, or you can go to my website at drweitz.com. Great. So we're going to get started. So our topic for today is how to increase fertility by addressing issues about intimacy, as well as overall health and wellness, with Denise Wiesner. Denise is a licensed acupuncturist and an herbalist, and the founder of Natural Healing and Acupuncture in West LA. She's certified by the American Board of Oriental Reproductive Medicine. She's a certified sex coach, and she's also a faculty lecturer for the Doctorate Fertility Program at Yosan University. And we'll be talking about her new book. It's a great new book, which will be available very shortly, right? And you can pre-order right now on Amazon and Barnes & Noble. Conceiving with Love, a whole body approach to creating intimacy, reigniting passion, and increasing fertility. Denise, thank you so much for joining me.
Thank you so much, Ben. We're looking forward to it.
So how did you become so interested in fertility? And the second part is, why did you decide to write this book?
I got interested in fertility when I was having sort of my own fertility challenges, trying to have my second child. And what happened was I noticed that it was just becoming a chore, and I wasn't being able to conceive, and I was pulling my hair out and very upset, and I was going to all sorts of different kinds of healers. And one of the acupuncturists I went to actually kept wanting to treat my breathing, and she didn't want to treat my fertility. And I was like, I don't care about my breathing, just put a baby in me. So I kind of really understand the struggles that my patients go through in trying to conceive.
Which is why a lot of patients literally go and have an embryo stuck in them,
Right. Yes, absolutely. So I appreciate it. And so my practice became primarily women's health and also fertility. So I treat both men and women going through trying to get pregnant naturally and also using Western reproductive medicine. So that's part one. and part two is that, as I'm treating all these fertility patients, I'm noticing that people are starting to talk to me about that conceiving is a chore. And they're starting to tell me all these kinds of issues, like, men who aren't able to ejaculate in their wives. So they're now turning to reproductive medicine like an IVF in order to make a baby. And when I asked them if they spoke with their doctors about it, they told me they said something, but nobody gave them any kind of help. And that made me really want to look at, is there help out there? Are there people talking about sexuality and intimacy and conception? And I found that there wasn't. So I decided to write a book.
No, it's great. I think there's a number of issues like that. Doctors just not comfortable talking to their patients about sex and their sex life, and other than a very cursory way, or just handing them a drug or something.
Yeah, no, it's happening a lot in my practice where nobody's really talking. And when I looked at like MDs and how many hours they get learning about human sexuality, I think it's like 20 hours or so. And right. Therapists get about 10 hours. Talking about learning about sexuality, unless they go on to become specialized in sexuality.
Yeah, no, I think many of the most important human concerns are sort of treated summarily like that. Depression, here's a pill. What about the end of life? Doctors don't even talk about it. Patients, undergoing cancer treatments, they're just taking these treatments a lot of times, which really aren't even designed to save them. And because doctors don't want to talk about that, have those difficult conversations. And so this is great that you're breaking this ground. This is very important that health practitioners either learn and become comfortable talking to their patients about this, or be able to refer to somebody like you who is comfortable about it.
Yeah, I think it was death, sex, and taxes, or like really hard stuff, something like that. I don't know.
There you go.
Yeah, yeah. So and it's funny because
and I will never show my tax forms.
Yeah, that's a whole other conversation, whole other podcast.
So, your book, you bring in a lot of Chinese medicine. And I was reading about some of these concepts of the wood and the air and the water energy and things like that. Maybe you can explain, how Chinese medicine can help us understand some of these issues.
Yeah. Okay. So in my book, I have a lot of chapters. I mean, there's chapters on fine tuning the engine, and there's chapters on orgasm and foreplay and stress and all sorts of things. But in this fine tuning the engine part, I really talk about the Chinese 5 elements. There's wood, water, earth, metal, and fire. So in Taoist tradition, earth is the center, and it's really about kind of like your digestion, really.
By the way, what's Taoist tradition mean? Is that
Taoist tradition is really where I based a lot of my stuff, because way back before, Taoist tradition was the precursor to Chinese medicine.
Oh, okay.
So really what's incredible about the Taoists is that they had this really equal relationship between yin and yang, male and female. So it's actually sexuality and sexual positions were given to patients if they had issues, like, oh, go do this position and that'll cure this problem, right? So the Taoists had a really great relationship to sexuality, which has since changed in our modern society, right? We have a lot of shame around it. But so there's a lot of Taoist breathing exercises that I brought into my book. But anyway, so
is there a double-blind, placebo-controlled, randomized clinical trial to show that position is of clinical benefit?
I think Masters and Johnson started doing that research, right? They had all that research on sexuality that came. I don't know if it was, and I think they did. They're the ones who really found it a lot. Kinsey, they did research.
Right.
But lab research is a little different than actually what happens in person, right?
Right.
So the earth element is kind of like the center in digestion. And it's important because, right, if you're feeling funky in your body, if you don't feel good, you're not going to want to make it, you don't want anyone to touch you, right? That really gets in the way of intimacy for both men and women if they're not healthy, not feeling good, right? So earth element, we deal a lot with the center. And that also includes like the digestion and your microbiome, right? How that's a big buzzword, right? You talk a lot about microbiome.
Yes.
Yeah. So making sure, because there's not only a microbiome in your gut, right? There's one in your mouth and on your skin, and there's actually one on the penis, and there's one in the vagina. And we want that to be healthy. We don't want a woman to have yeast infections and all sorts of infections, which women do get. And we want to have that balanced. So that's kind of part of the earth element is learning about the center. And Chinese medicine is funny because it just doesn't look at digestion only. It kind of looks at emotions. So there's this saying that overthinking and overworrying damage spleen and stomach, which is digestion, right? And we know that doesn't happen for anybody in this society anymore, right? Right?
Yeah. So everybody's so highly stressed and overworked and trying to fit everything in. And yeah, absolutely.
Right? Like eating in your car, like I'm trying not to do, but like shoving in the food as fast as you can, right? There's no digestion happening, no enzymes.
Absolutely. And it facilitates eating of fast food because so many fast food items come in wrappers that you can hold in one hand and shovel in.
While you're driving and talking on the phone.
So you mentioned the vaginal microbiome, and that's a really interesting topic. And we've had some women use probiotics vaginally to help with yeast infections, and that's something we're just starting to understand.
Yeah, no, it's really important because what happens when a woman during her cycle is her pH of her vagina that's supposed to be acidic starts changing around the time of ovulation, because the cervical fluid that she produces becomes a little more alkaline, so the sperm can live in the cervical fluid, right? So they can swim up to meet the egg. But if a woman is not acidic, she's, more alkaline during the month, she's going to produce more yeast, right? Because you really want an acidic vagina. So there's all sorts of lubrications that people use out there. And I've spoken to lots of lube companies and got a great education on lubrication, and really more than I wanted to, but I learned a lot because our unlike our mouth, when we digest something, we have a lot of acid in our stomach, which breaks things down and gets rid of bacteria, right? But when we put something in our vagina, it's just the mucous membranes, it absorbs, it's much like our rectum as well. So when you go to use a lubrication, you want to make sure that it doesn't have preservatives in it, like parabens, which the FDA has said is fine, but I don't think is fine. So no parabens. And then there's also this thing called osmolality of lubricants, which means the ability of it to pull out water from the tissues. So a lot of lubes, the reason why women get very wet is because it pulls out the water from the tissues, and that helps. It really dehydrates the tissues. It's not good for the tissues. And there's a lot of lubes that have this high osmolality. So with lubes, there's lubes that are good for fertility around that ovulation window because they're a little more alkaline. They say they don't kill sperm. There's only a few that have been FDA approved. The FDA now approves them for fertility, believe it or not.
Huh.
Yeah, so there's a few of them that have.
Is there a natural type of oil or other fat that makes a good lubricant?
Yeah, I mean, I think I personally think coconut oil is great. I mean, obviously, if you're trying to protect and using a condom, it's not good because it'll just eat up the latex. But right. In terms of hopefully women, truthfully, if women are healthy and their cycles are really good and they haven't had surgeries on their cervix, they should be producing a lot of cervical mucus. And that's kind of what my job is as an acupuncturist and herbalist, is to kind of help women to produce more cervical mucus. And, even something like N-acetylcysteine, it thins out mucus, right? It's an antioxidant, but I give it sometimes for women because it actually thins the cervical mucus as well, right?
Interesting. Now, coconut oil is a little alkaline, right?
I don't know the pH of the oils. Do you know the pH?
I just recently interviewed Jennifer Fugo, and we were talking about the gut-skin connection, and she was very outspoken about the fact that I haven't posted the interview yet, so it'll still be several weeks away. But she felt that coconut oil was too alkaline, and the skin needs to be more acidic. So she didn't think coconut oil should be used on the skin.
That's really very, very interesting, since everybody uses coconut oil everywhere these days. But I mean, the thing about it is that, really truthfully, women who are trying to conceive really should produce their own cervical fluid. Right. And that is the truth. If you're not producing, you're dry, then there are things that we can do to help make that, by giving women herbs and nutrition and looking at everything, looking at their whole body. And that's really the truth, unless a woman has had surgery. So I sort of steer away from the lubricants because, okay, here's another thing. And this is in my book. And a lot of times women will become, because we have all these glands that secrete lubrication, right? If a woman's not sometimes making her own lubrication, not only can it be from just maybe her diet's not good, but it can also be from not enough foreplay, which, people don't know, but it takes women 20 to 45 minutes to really become aroused. And if you give a woman enough time, so she will be. And when you're doing baby making, a lot of that time that goes out the window. So a woman's uncomfortable and it's painful. So that's just one thing.
Interesting. What role can functional medicine play in understanding fertility and in helping a couple improve their ability to conceive and have a healthy baby?
I mean, functional medicine is much like Chinese medicine, right? It's looking more in depth at what's out of balance in a patient's body, right? So functional medicine is great because it's really looking at the systems, doing blood, making sure, obviously, the thyroid's working efficiently, right? Thyroid has to function for fertility. And There's actually lower ranges for fertility. Doctors want your TSH 2.5 or less. But what happens with doctors is they just do a TSH. And they don't look at like antibodies, TPO antibodies or TGA antibodies. And some of them have very, very high levels. That's where the sort of functional medicine people do look at those things. And therefore are interested in why someone would have high inflammatory markers, right? And try to get the inflammation down. So, if I have women that have high TPO antibodies, we'll be, doing some types of antioxidants to help bring down this high level of inflammation, and also looking at their diet like functional medicine does, right?
Right.
Are they eating an inflammatory diet? Are they eating a lot of grains? Are they eating dairy? And so Chinese medicine has similar kind of ways that we look at things, but functional medicine brings in the actual lab values, the actual stool test, the actual hormone test, and we can look at those in a much more in-depth level than just, or sperm for that matter.
Right.
Yeah.
Good. Can electronics like laptop computers and cell phones affect fertility?
Yeah, I treat a lot of men, and I'm pretty lucky that way. And it's amazing how many men like carry their cell phone in right next to their scrotum. And it's, electronics are heating, and there's research about even just talking on the phone can increase your chance of having lowered sperm counts. So I really do try to discourage use of electronics, and electronics in the bedroom get in the way of making babies. Because when everyone's like on their, checking their email and doing all this, right?
Yeah.
There's no intimacy. So
Right.
One of my big things is like trying to get electronics out of the bedroom.
Right.
I'm probably guilty of that too, but yeah. So
yeah. And, with 5G coming, we're going to have even more higher levels of magnetic radiation entering our homes through our electronic devices, et cetera.
Yeah, it's very scary. My son's a computer science major, and he's like always like, that doesn't matter, whatever. He's like, show me the research. But I think it does interfere. I mean, what's going on with our society that men's sperm counts are so much lower than they've ever been? What's going on when I see these men who have unexplained low sperm counts? Like the doctor can't find anything wrong genetically, and they don't know why. That's very interesting to me.
Yeah, literally from the small sample we've had of the men we tested for hormones, 80% or more have low free testosterone. So it's really getting to be really common. And part of the problem has to be some of these estrogenic substances that you mentioned, phthalates, and there's a whole series of them, bisphenol A, pesticides, fire retardants, Teflon, et cetera, et cetera.
Right. And that's sort of that idea, about detoxification, right? And we have that's functional medicine. It's also Chinese medicine. It's the liver, and we have to be able to detoxify. So oftentimes I'm, testing and also putting people on detoxification, especially if they're going through like an IVF and they're taking a ton of hormones. I mean, these women have estrogen levels up really, really high. And I will afterwards just tell them to do like a little bit of a liver detox, because I know that, we're not supposed to have those superhuman levels of estrogen in our bodies, right? And then they pee that out, and you wonder, where does that estrogen go?
Right.
Right?
Yeah, I mean, speaking of hormones, what does being on birth control for years and even decades do to a woman's ability to become pregnant?
Some women who are on birth control pills, some women don't get their periods back. It's very interesting. I have to work very hard to reestablish the HPOA axis, the hypothalamus pituitary ovarian axis. Some women do get their periods back with a little coaxing. I think, they give birth control pills oftentimes without really checking women. I mean, they don't check to see if women have any kind of clotting disorder. It's interesting. Right. And then they find out like, oh, I had a clot on the airplane. And it's like, I'm on birth control pills. Whoops, I shouldn't be on them. But they don't do a lot of testing. They hand them out, like you said. They just sort of hand them out to everyone.
And essentially, it's a chemical, castration. These women are, artificially having their menstrual cycle stop with chemicals for years and years. And so their body's not naturally producing these hormones.
Right. And there's a difference between the synthetic hormones that, that you get and the ratios of them and how they're pulsed, right? We take hormones are pulsed in a certain way, and you take a pill, it's not quite the same. So I think it must have some impact, and I don't know there's a lot of research on that. I'd have to really look stuff up. It's a very interesting thing. I'm not a big fan, but for those who have unwanted pregnancies, I do see that birth control pills, are the best form of birth control at this point in time. So it's a hard call for women. It's a hard thing, what to do,
Yeah, no, I understand. Um, can you talk about some of the sexual problems that men and women have that they often don't want to talk about, and why don't they talk about these?
Yeah, this is my favorite thing to talk about, actually. um, Really, because it just lets people know they're not alone. So I have like men who have difficulty perhaps ejaculating in their wife, and I have a lot of men that are really shamed around that because they've not ejaculated in a woman for years because they were trying to prevent pregnancy. So they didn't learn how, and maybe their masturbatory style is very different than when they make love to their wife. And so it's just a different sensation. So it's learning how to redo that style so that they can ejaculate. And there's many reasons why men can't ejaculate in their wives, right? Some fear of making a baby, or sometimes, what's really interesting is there's a lot of SSRIs. One of the side effects of SSRIs is they have it's hard for men to ejaculate, and it's hard for women to reach orgasm. And I actually interviewed somebody that was a psychiatrist of functional medicine, Hyla, Dr. Cass.
Oh, yeah.
Yeah, I interviewed her because we were talking about what can these people do, because they're given SSRIs, and maybe that's not the best thing in order to make a baby because no one's orgasming and no one's ejaculating. So that's a problem. And so that's one of the things. And then I also have where men can't get an erection when there's pressure. So like when they know their woman's ovulating and they all of a sudden have to perform, it's that like moment and the woman's like, okay, now honey. Men sometimes just can't really perform on demand, right? And so my book is really this idea of maybe men don't need to know when their wives are ovulating. Some men like to know, but maybe it's this idea of having intercourse more often, having connection more often. So it's like you're having it, and you're also having it during baby making time. It's not just this like, okay, this window, we have to do it now. And then men are like, ah. So right. I see those things in men, and I see some sexual pain in women that they don't tell anybody, that like it actually hurts and they don't know why. And oftentimes my job as a Chinese medicine practitioner and sex coach is to like, you need to go to a pelvic floor physical therapist. Like your pelvic floor is like gripping, and I had a woman who couldn't have intercourse because every time she had intercourse with her husband, she'd get a UTI, urinary tract infection. And so it started becoming, she had vaginismus. Her muscles started closing down, and they couldn't have intercourse for a long time because of the trauma of thinking like every time we have intercourse, I'm in pain. So unraveling that takes a few people, right? It takes like the physical therapist and some emotional support, and I can help. And so it's really pointing people in the right direction.
Yeah, probably could use some cranberry D-mannose to coat the urinary tract to make bacteria less likely to adhere.
Right. So it's really addressing, exactly. It's addressing it in many different avenues, not just the pelvic floor physical therapist, but it's also looking at how to relax the woman and how to prevent UTIs, like what's going on that she keeps getting UTIs, and help, the gut function and exactly what you're saying. Perfect.
Yeah, and those antidepressants are handed out like candy. And then there's a series of other drugs. So, for example, some of the drugs that men take to try to increase hair growth, like Propecia, also affect erectile dysfunction. So.
Oh my God, and toxic to fertility. So
yes.
not good for, all those things, right?
Right.
Yeah.
So when in your book, you talk about the benefits of orgasm in sex besides, being able to conceive.
Oh yeah. So it's orgasm, but you know what? It could be like a deep hug, it's oxytocin. It's the hugging drug, right? And it's like 30 seconds, 20 to 30 seconds of like that deep embrace. And you produce these chemicals. An orgasm is the best, because orgasm, there's something that happens where your brain, it just stops and like you don't think about anything, right? It's this moment that's really beautiful for men and for women. And it's sort of an enlightened state. I mean, it's a state where you can really ascend. It can be a very highly spiritual state. It's not just about like, we gotta have an orgasm, but it's this connected, beautiful moment in time where all these feel-good hormones are in your body. And we want more of that, because those help our immune system, actually. Like sexuality is good for it helps our immune system. And that's a very important fact that people forget because they're so busy. People are so busy at work and so stressed out that they can't, the idea of like taking it, an hour to like, have lovely, slow connection with the partner doesn't happen. I mean, I have people that don't even have date nights. They see each other very little, and maybe on the weekends only.
Right. Well, it's interesting that this problem of, if you call it a problem, I think it is, of people having less sex and having less babies is actually something that we see throughout the Western world. And you see in a lot of these countries in Europe, et cetera, where the native population is becoming a minority, partially because they're not having a lot of kids. And in some of the Scandinavian countries, they actually have commercials on TV encouraging people to have sex.
Yeah,
government incentives and stuff for them to conceive.
Yeah, it was kind of scary because I attended a reproductive endocrinology lecture, and the doctor, a reproductive endocrinologist, is talking about how he thinks that one day it's just going to be like you go to get an IVF to conceive your baby, and then sex is only for fun, and it's not used for fertility anymore, for making a baby. You just sort of do it in a lab. And I thought, oh no, that's such a scary, is that what's going to happen? We're going to all like have these designer babies, and to me, that's a scary thought. That's not good.
Yeah, we're connected. We should be way more connected to the earth than we are. And that's like the most extreme example, yeah.
Yeah. I mean, when healthcare dictates that, right now, IVF is you have to have, some insurances cover it, but you have to have money. And it's really unfortunate because there's some people that really need IVF. I have men who sometimes have, I have testicular cancer guys, like quite a few in my practice, and their sperm counts sometimes aren't as good to make a baby naturally. So they need the help of IVF, and that's what IVF is for. So it's not I'm not anti-Western medicine. It's just that some people rush to it when they don't really need to because of the fear and the anxiety we have in our society. And maybe they're having relationship issues as well. So,
right. When men have issues with sperm count or swimming ability, et cetera, what are some of the things that can be done to help?
Oh, so glad you asked that. In Chinese medicine, first of all, Western medicine, there's a lot of, or I should say functional medicine. There's a lot of nutritional substances that we give men. We give men fertility formulas that contain like CoQ10 and vitamin E and selenium and zinc. Zinc is very important. L-arginine is good. L-carnitine. Those are sort of standard in men's fertility formulas. But then there's actually specific herbs that men can take to help like their libido and help sperm. But it really depends on what's going on. So a man who maybe has a low sperm count due to maybe a varicocele, so it's like a varicose vein in his scrotum, he in Chinese medicine would need more like cooling of his testicles and more blood flow and cooling herbs. So, we might have him just put an ice pack actually to cool them down and take herbs for blood flow, which would be different from a man who has a low sperm count due to we call like low kidney energy in Chinese medicine, or maybe he's overstressed or he's over exercising or something of that nature. So herbs like, I was just pulling them up actually looking at my book, and one of my patients who had testicular cancer, a doctor told him he should take ashwagandha, and he called me, the doctor says I should take ashwagandha. What do you think? And I thought, yeah, ashwagandha, ashwagandha is a great adaptogenic herb. It's shown to like improve sperm, interesting enough. And it's calming. So it would be a great herb for him because he was sort of anxious. And I also give cordyceps. It's a fungus that's lived on caterpillars, but they make it. Cordyceps it also helps sperm, and it also helps egg quality. And it also helps good for stress, for your adrenal glands to be good for them. So that modulates. And then there's things like, we call yin yang huo, horny goatweed. Horny goatweed is an herb that helps libido. There's a bunch of them. Yes. And they're usually, what I want to say is like ashwagandha. Okay, you could take ashwagandha singly, but there's these amazing formulas that have like all the adaptogens and like rhodiola and ashwagandha, and Siberian ginseng. And I kind of like to take herbs in formulas as opposed to just single herbs. It's how the Chinese do it. And I find it's much more effective to give a formula for a man than just a single herb.
As a provider, how do you bring up questions about sexuality with the men and women you're seeing?
It's a great question. I have a form that they fill out. And one of the questions is about libido, because it's part of who we are as humans, right? It can tell us a lot about what's going on if there's deeper issues. I mean, I had a man who couldn't get an erection, and really it was, and he ended up having a heart attack because it was blood flow issues. So I think it's a really important question that we need to ask if we're providers, our patients. Yeah. So we shouldn't eliminate that question. So basically they put a check on my form, and a lot of women, really, I would say 98% of my patients that are women check the low libido box. And so I basically ask them, hey, you check the low libido box, and I'm, want to know what's going on. And really to try to find out, because libido is really complicated. It's complicated for women, maybe less so for men. But it's complicated for women. Like, is it stress? Is it past trauma? What's going on? So we go a little in there, and then men oftentimes on their checkbox, if they have erectile dysfunction, they check it, believe it or not. So I just say, hey, you check the box with low libido, erectile dysfunction. What's going on? And believe it or not, people really want to talk about it because nobody asks them, and they don't know what to do about it, and they don't know who to go see. And it's just this sort of like shame that they live with. And I'm really encouraging more providers to talk about this area, and also refer out and let them know that there's therapists that actually specialize in sexuality, that you can talk about these things too, if there's trauma or past issues with this, right? And I just feel like it's important for people to be empowered around this topic.
Yeah, no, I think this is a very important book. And by the way, I think your next book should be about sexuality after menopause, because that's another whole set of issues.
Oh yeah, I also treat that. That's a whole, or sex after kids, right? Like where everybody's like scrambling around. You remember that? Like, everyone's like, oh my gosh, I need to sleep. Like, don't touch me. So yeah, sex after you have the baby or in menopause. But there's
sex after your hormones fall off a cliff.
Tank, yeah. I think that, and just to mention that, and that's not in my book, but just to say that, because yes, menopause, I know that intimately. It's not, well, I think it doesn't have to be a tank. And if you ask some women in their 50s, they'd say they have the best sex that they've ever had in their entire life. So this idea that everything has to tank, sometimes it's just that women have been in the same relationship for a really long time, and everything's very predictable and everything's kind of boring. And remember I mentioned that like 30 to 45 minutes of foreplay, that's not usually happening. And so maybe if there's a way to spice things up or recreate things, or, women, surprisingly enough, maybe can change. So women think, like it's very common that a woman in menopause, her husband will be like, hey, let's have sex. And the woman's like, oh God, I don't want to, like, but if a man were to really arouse, and I don't mean like just touching it, maybe a woman would be in the mood. So I just got a rose today from one of my colleagues, and these rose petals are super amazing. You could just take a rose petals and lie them on the bed and just do a touching exercise with rose petals. I mean, when do we do that? Who has time for that anyway? But it's just to remember these kind of small things can really wake people up. And that even though a woman's in menopause, maybe she hasn't been touched by rose petals in a very long time in her life. And maybe that would be the thing that would kind of light her up to really back into her moment. So I'm not sure. I'm not wedded to like, it's only because women's hormones drop, I see plenty of women who don't have hormones who have a fine sex drive. So that's a whole other topic.
That's great. So one more question, since we seem to be in a marijuana revolution in this country, and we live in California where marijuana is now legal, and it seems like everybody's starting to experiment with CBD oil in healthcare practices for every possible condition. Well, how do these affect fertility?
We see CBD everywhere. First of all, marijuana is not good for sperm. Sperm slow down, and it's not good. So if your man is smoking marijuana or ingesting with edibles or whatever, I would say give him 70 days of no edibles, because it's not good for sperm counts. And that's just,
sperm slow down. They just want to sit on the sofa and not go to work. And
yeah, sperm, not so good. Yeah, sperm. It's just not good for sperm, and I've interviewed enough urologists, reproductive urologists, and they've told me firsthand, please don't, no marijuana for sperm counts. We don't know. I don't know if there's any research on egg quality, but I imagine if it's not good for sperm, it's probably not good for eggs, and we just don't know enough about that. That's just THC, right? But then there's CBD. The problem with CBD is that we don't know enough about CBD. So there's CBD from hemp and there's CBD with THC in it, and we don't even know. There's no quality control of CBD at all. So you take CBD, you don't even know what you're getting. I find like every vendor wants to sell me CBD, and I don't know really how much is in it. Do you find the same thing?
Yes, I think there's a lot of confusion about it. I think there are some specific rules as far as if you want to sell CBD, it has to have less than a certain amount of THC. And if it has more, then it has to be,
well,
I guess it's all legal, but I guess
you know what? CBD, no, but there's CBD from hemp and there's CBD from cannabis, right? The CBD there's made from hemp has no THC in it. And the CBD from cannabis, I think, maybe does or doesn't, or I'm not really sure. And there's so much debate about that. So I'm not anti-CBD. I see it do some good things. I don't think it's the do all end all. I think it's just the rage
for sleep and relaxation.
Yeah. And I'm not anti-CBD at all. I actually have used it myself and think it's really good. And I love the CBD ointment for pain. I think that's great, and inflammation. But I think if you're trying to have a baby, until we know more, it's hard to say because I don't know that there's any research. I do have a colleague that did a lot of CBD oil in her 40s and did get pregnant. So that's just kind of a funny aside, but I don't know. And I don't recommend it because I don't know enough of research about it.
Right. Great. So any final thoughts for our listeners? And then maybe you can tell us how viewers and listeners can get a hold of you and where they can pre-order your book.
The final thing I want to say, and we're so focused sometimes on money making and busy and lab tests and health that we forget to kind of drop into the place in our hearts where the love lives. And it's always a good reminder to really live in that place of love. We can live in fear, and there's enough of it in our society right now, but just be in gratitude and love is the best place we can arrive to. So that's really that's why I think conceiving with love, it's all about the love, all about the love. That's my final thought. And then if you want to get a hold of me, I have a website that's my name, Denise Wiesner, WIESNER, and .com. And there's a lot of information about me and what I do. And it also links to my clinic. And my book is available through Amazon. It'll be available pre-order and out May 28th. And it's also, I think, in Barnes and Nobles, and it's published by Shambhala. So you can also get it on their website as well.
Awesome. Thank you, Denise.
Thank you, Dr. Ben Weitz. You're the best.